We're a collaboration of 16 national health charities that was founded 30 years ago. Originally, we were designed to be an organization that simply raised money for our 16 national health charities: Canadian Cancer Society, Heart and Stroke Foundation, Alzheimer's, Arthritis, Diabetes, some of the largest, Huntington's, Muscular Dystrophy, Parkinson's, some of the smallest, but collectively we touch the lives of 87% of Canadians that are likely to be diagnosed with one or more chronic diseases. Over time, we've evolved into an organization that still continues to connect employees and workplaces with the health charities that matter most to them, but we also work with employers to try and help improve the health outcomes of employees and workplaces across the country. We have a number of programs that we offer, something we call small steps, that are designed to help employees understand the link between their own behaviors and what those might lead to in terms of increased risk for contracting certain forms of heart disease or cancer, diabetes, for example. But we also work with employers to offer presentations on mental health in the workplace, work-life balance, from the perspective of what can I do as an individual, what can you do as my colleague supervisor, what can we do collectively in a workplace to address some of these issues and take the steps that we need to in order to improve our health at work. We primarily are focused in federal government workplaces across the country where there's a lot of concern about mental health in the workplace. What we try and do is draw the link between mental health, depression, and chronic disease, and how it's a huge circle. That if you are depressed, you're less likely to do the things that can reduce your risk of contracting chronic disease. And if you have chronic disease and you're depressed, your health outcomes are seriously compromised. So we try and take a different perspective about the relationship between chronic disease and the mind-body connection. What we try and do is cut through a lot of the noise that's out there, because it's fairly straightforward what we can do, right? And it's been referenced several times throughout this conference. Eat well, exercise, sleep, try and find some sense of balance, right? Those are the four things that we know make a difference to human health. The problem is that there's so much noise out there. If you want to lose a few pounds, is it keto, Atkins, high fat, no fat, low fat? How do ordinary people make sense of all of that in a way that works for them in their daily lives? So we've developed this Small Steps program that really tries to cut through all the noise and says one of the best things you can do is consume between 6 to 8 servings of fruit and vegetables a day. If you do that, you will have a more significant impact on your health outcomes than almost anything else that you can do.